Hello. I hope you guys are doing pretty well. I'm personally doing fine. The only problem that I had is the fact that I could not really sleep well last night, and the main reason why is because I had multiple naps throughout the day, and then when it was like time for me to actually go to bed, when I actually thought that it was like 2 or maybe 3 times for me to wake up and start reviewing was just 11, and I was like, oh damn, I gotta wait. But now I'm kind of fine though. Do feel like I'm a little bit tired, which is effed up because I had time to sleep, I had time to rest, but for some reason I was so excited, also just so happy to maybe start the day, which is really weird. And then boom, I just ended up having some sleep, but not the right kind or right amount of sleep, I guess, or not the right way sleep. And that's how I ended up being slightly tired right now. But it is what it is. I'll be just fine. And today I'm gonna have my third BSF exam, which is pretty much like anatomy and physiology and pathophysiology, like all included. But it's like very surface level, so I should be fine, I guess. I already passed 2 of my exams. Like it's like 4 for this specific section, the BSF section. I already passed 2. I'm gonna have the third one today, and then we're gonna start lecture for the fourth one like right after this. So it's gonna be pretty excited. Today we're gonna be talking about something that I want to vent. So it's mostly gonna be like a let's vent about something video instead of like I sit down and I talk about like some specific stuff like I did for like the last 2 or maybe 3 videos that I already published or maybe put out. So we're gonna be talking about mean coworkers because some of them people are mean and it is what it is, but we can talk about it. So let's go. All right. So some people might think like being in healthcare is like the holy grail, holy grail. I think that's how they said of like nice career or maybe like nice path. Like hey, a bunch of people really excited or maybe really into about 7 people and they just got together and they are working towards the same goal that they all have or they all share, which is I love my job so much I want to help people. So that's what I initially thought, but it quickly changed when I first got into the floor. At least I'll say when I first got into my floor, to be honest. Well, you know what? Let's say got into the floor. I'm not gonna be really specific because I do know some people on my floor. Not all of them are actually the way that I'm gonna be describing, but hey, it's like a good amount of them, to be honest. And most of them already left. So just gonna put this out there as a cautionary tale for other people that are getting into healthcare. Like, it quickly changed. So many people were nice to you, like genuinely excited about the fact that somebody new is, um, came into the team and then right now they get to call you coworkers and they're helping you, like to get along and navigate everything so that you can be as independent as possible. So also have people who generally won't trust you and will try like to micromanage you at any single moment they might find. Cause there's like multiple moments where you can actually micromanage someone, which is a little crazy when it comes to healthcare. And yeah, it will just like look normal, like passive aggressive, but it's really aggressive and nothing positive. Like the only positive thing about it is the fact that hey, you know what? It's not only gonna be like one at a one time occurrence, but it's just gonna happen like so much time after that we can literally consider as positive. Aggressive just because the thought of it. Like literally you'll have people will try to teach you how to do your job, a job that you know how to do well, but you're just not doing it as they want or maybe as they expected. Or you will have people who will generally see you doing your job and then come in your back and tell you something like, did you do this? Yes, I did it. And you also were there when I was doing it, which is a little crazy. But it all happens, like some people just try like to put themselves as hey, I know more than you, or I'm very much more superior than you, or I really don't know what they're onto, but I do know like they're onto something because there's literally no way that you might not be onto something and acting like this. Because if you're not, that's something that you should be seeing a doctor for, but not making other people's life miserable. But it is what it is. That's kind of like the way that it is, to be honest. I'll say for one part. Don't get me wrong, they're also not kind of people. So there's like people who generally don't know what they're doing and they just try to make everything your job just because they don't know what they're doing. Like, I'm not gonna say that. So let's just come back to what I was saying. You know what? I need to find an example to actually illustrate what I was saying. Like, okay, cool. Let's say, for example, you receive a new admissions, right? Patient is incontinent, patient is bedbound, so therefore you'll never have to take care of the urine. There's not multiple way around it. But on my floor, not really. Like I know some hot like other establishment, they might give you some adult undergarment, what we commonly call diapers. So on my floors we don't use that. But like we mainly like do one thing. Well, one thing to be honest, if they'll qualify for it. If they'll qualify for it, we use a Puric, and the Puric is pretty much like a suction device. And the suction device, I could just like place it in in between the part where the urine actually comes out, and then you just hooked up it to the wall. But before you hook that thing up, though, there's that multiple things that you gotta do. Just make sure that the suction is working. Make sure that you get the tubing for the suction. Make sure that you get the kind of like a reservoir, maybe like a small little tank. Make sure that these are connected right to the tubing, because if they're not connected right, it's not going to be suctioning. And if it's not suctioning, the patient will be incontinent, and then the patient will be wet. And then if the patient is wet for a really long amount of time, and the skin will eventually break down. The skin break down, the patient will have a pressure sore, which is going to be in the hospital, which will then investigate, and then we'll say like, hey, it could have been you, or that's actually you because the patient wasn't their care. So why did it happen? Because those things are preventable, to be honest. So yeah, so you'll literally have some people who generally don't know how to connect the tubing, and they'll maybe have a new admission, not tell you anything about it, and patient will be incontinent, and then patient will have like urine all over the bed. Patient have urine all over the bed. It's some. I'm not gonna say like it's something that uh you can avoid totally, but it's partially avoidable. The reason is, you don't know how to connect the tubing, so just call somebody who knows how to connect the tubing, and then learn it right here and there. Don't just be like, you know what, connecting the tubing is actually not my job. It's the CNA job, so therefore I'm just gonna let the CNA do CNA job, and I'm gonna be doing my job. It does not really reflect the fact that somebody doesn't. Well, it does kind of like reflect the fact that he or she doesn't know like what to do, but it's just like a little lazy me. So it's literally laziness. Like, and all of that could have been avoided with the fact that, hey, you know what, I received a new admission, and therefore I know the patient is incontinent, so I'm just gonna be calling you so that we can fix that together. And at the same time, I'm gonna learn what you're doing, because what if one day I come to work and you're not here, because schedules doesn't necessarily match all the time, and it is what it is. But relying on someone to actually do the job or do something that can be learned in literally like 2 or maybe 20 minutes is still a little bit crazy to me. It's laziness, and I don't subscribe to that. So that was this for the second point. And the other thing that I really want to vent about is the I am busy kind, or I'm busy type. Literally, like, I do 12-hour shift, and I've been doing 12-hour shift now close to 3 years, which is a little crazy. If it's not 2 years and close to 3 years, to be fully honest, but I don't know. I'll say close to 2 years, because I really want to be true to the timeline. So yeah, I've been doing 12-hour shift for a really long amount of time now, and I can count how many 12-hour shift that I already did, but sometimes, not gonna say all the time, like the kind of nurses that I do have, and yes, I said nurses because, well, it's not a fight between CNA and nurses, to be honest. But all right, let's talk. Like some kind of nurses that some nurses that I sometimes get are like the I'm busy kind of I'm busy type nurses. Like literally, like you will call this nurse 4 maybe 5 times, and they're busy doing something. And the thing that they're doing, I ask you not, is I'm giving out medication. Like how much time do you need to actually pass and give out medications? Like I do get it, some medication might just be ordered, and then there's something that you might need to figure out with the pharmacy. Just make sure that this medication is ordered for the patient. Well, the order is there, so therefore you're waiting for pharmacists to actually fulfill the order, and then so that they can send it to the tubing or go down together. I get it, but I fully believe that you can be organized with your work, and therefore help around if there is people that actually need helps. Like just saying you're busy does not really cut it, or does not really cut it all the time, because busy or not busy, we can tell you if you're busy. You can be busy and having your work phone on the side, and just calling your Facebook account, and just like having the time of your life, while somebody's just working the butt off and trying to get to the other line or other side of this 12-hour shift. That's not busy for me. That's laziness yet again. But yeah, it can be busy, and we don't know where you are. Like, you're busy doing what? I'm busy. What are you doing?
No, I'm busy. Well, can you meet me on 125, please? All right, so I'm busy. Whenever I'm done with what I'm doing, I'll join you there.
Never actually comes. Never. And you also have the other kind of nurses that will actually like see what you're doing for a specific kind of patient, right? And they know that what you're doing actually need two people or having two people or more people to actually do what it is you got to do. Would that make me way much more easier for you, way much more comfortable for the patients if you have to turn the patient has a fracture or something like this. And yeah, so that just make it better for everybody else. But for some reason, they will just like try to close their eyes on it and they act like nothing is happening, which is literally effed up. Like, why is he doing this? But for me, well, it used to be a problem. It's not really a problem anymore because I do speak up. Like when I do need help, I'll be like, hey, you know what? I need help. This, I'm gonna be doing it. I need help because there is literally no way for me to actually try to do a two-person or three-person jobs. I'm not well, yeah, a two-person or three-person task that requires a task that requires two or three-person by myself because there's literally no need for it. Because what am I gonna do? One, wasting time because the time that I'm spending to actually do these tasks that requires more people would have been well spent if I did had more people. I would have been doing it way much more efficiently, way much more fast, way much more quickly, and I've been way much more better for the patients because I work night shift and the things that we typically do for the patients. So we either wake them up in bed or we literally have to talk to the patients to make sure that hey, you're okay. Like for example, hey, I'm gonna turn you now. It's time. Like hey, I'm gonna change your pad because I've seen that it's wet and I don't want to let you lay on the wet stuff. Even if they sometimes they'll tell you something like, hey, you know what? I don't want this change right now. You can't take this as an answer. At least you can't take this as an answer like the first time around because you got to make sure that hey, they really understand what it is you're trying to do for them because sometimes they don't. They don't. Damn, I like all proudful, like, hey, I know why I'm here and what it is you're doing. I know your job way much more better than you because they'll meet some patients who'll think that they know your job way much better than you. But like the right thing is, to take a step back and you talk to them and you say like, all right, so this is exactly what I'm gonna be doing. And yeah, I do change my voice. Like me talking to you right now and you on the floor is two different kind of person or even me talking to a patient, it's like three kind of person to be honest. Like I'm like the sweetest guy ever. But yeah, so you're gonna say something like, all right, so are we gonna be doing this for this? Or hi, how you feeling? And then you actually know or you see that they're uncomfortable even if they're not saying it. But if like sometimes they will just like try to argue with you. So you just take them where they're at. You take them where they're at, like, hey, how are you feeling? I feel uncomfortable. Let me take a look at your back. Oh my God, your back is wet. So do you want me to change that for you right now? Oh yes, please, because I'm comfortable. Instead of being like, uh, hi, turn please. Oh yeah, your back is wet. Do you want me to change it? No, not do you want me to change it. I'm gonna change your back. They rightfully can tell you, no, I don't want to. Because you might be mean to them, and for some reason they might think like, hey, you know what? You were mean to me, and therefore the way that I'm gonna punish you is by not letting you do your job. But the thing is, it's not really you're punishing someone, but actually you're punishing yourself because by laying on the pee, it's like you giving yourself way much more opportunity or your skin way much more opportunity to actually break down and actually make more problem for yourself, getting this thing infected and then becoming septic because you generally did not think about it or that's the whole thing. I'm not gonna try to take anything from step 1 to step 15 because I'm a yapper, like you guys can see. And that's not the purpose of this video. So the purpose of this video is kind of like reflect on main characters and kind of like reflect on multiple kind of nurses that I actually met throughout like me working them 12-hour shifts. So that's what I'm gonna keep it at. So yeah. And sometimes I get to meet like one of the nicest kind of nurses ever. Like mostly new grads, which is a little bit effed up. Cause sometimes I'm like, what's the reason why do you think so and so might be nice? Is it because she just started? Well, even if she just started and she's not, that's kind of like pretty good mindset though. It's like her or him opening up to, you know, criticism, which is pretty good. Like opening up to criticism at very very early on can, help you learn way much more than what you might thing that you're supposed to learn because everybody will be pretty happy to teach you, but you also have like people that will try to micromanage you and also like tell you stuff. but they'll still teach the as long as don't take this thing personal. Like, yeah, I'll admit like some of the nicest nurses ever, like mostly new grads, and they were just new to the facility, and therefore they're trying to get their way around. So it's pretty nice to see like them communicate, following up on stuff. That's like how I expect nurses to be honest. Like, hey, there is like this task that we need to do, right? And it's a two-person task, or maybe a three-person task. I'm gonna be doing something on 125 or 126, and as soon as I'll be done, I'll give you a heads up so that we can do this task. See, I like how simple and how nice this was instead of just one. Not giving an F or not giving a damn about this specific task that we gotta do, and then just wait till the last hours to actually go do it, or try not to see that the task was there like all along and then be like, oh my god, he didn't do it. Like, no, it's not me that didn't do it. I did not know it, or you did see it but I didn't see it because I was busy doing 25 things, but you were not doing anything and didn't tell me anything, you know. Yeah, it get really frustrating sometimes, even like right now as I'm thinking about it, like multiple occurrences that I had when this thing actually happened, or this specific scenario that I just depicted actually happened. But yeah, so they're really nice. They communicate with you. They are nice to the patient as well. And one of the things that I did see though with being nice to the patients, it's like I'm not gonna say not be nice to your patients, but some people are yappers like me. Like the nicer you show them that you are, the more they are willing to yap with you, which might be a little problem if you don't really know how to manage your stuff. Because let's say that you go to a patient's room, right, and you're giving them the medications, and you're talking to your patients, getting to know your patients, which is, well, technically, I'm not gonna be saying nurses, but I'll say human decency. Because hey, you're interacting with someone and they want to talk to you, they are interesting. I think like the basic thing to actually do is like, hey, you talk to them back. And as a nurse, so there's other implications that involves like, hey, you're not only nice to me, or I'm not only nice to you, I'm technically responsible for whatever happens to you. So therefore, like, you feeling your best or you doing your best is actually um my best or my priority. So yeah, that's all comes to it. But it's not only like nursing related. So I don't want to say like the fact that you're interacting with someone or you're generally showing them interest is nursing only. So I'll say it's human decency as well. So yeah. Some of the times, like if you're not really sure or you don't really manage your time well, so this can actually be a downside, and you'll just ended up like yapping or maybe talking to a patient like for 2 hours and not passing meds, and then next thing you know, you had this patient asking for pain meds, this patient on a specific medication that was supposed to be starting at this specific time, but you couldn't actually go, or you don't know how to close a conversation and actually go with the med, which is actually a really big thing though. Like, one thing that I've learned pretty early on was like how to close a conversation. Like, be nice to everybody, but also know when you need to go, because some people it's really hard to just like tell them like, oh, okay, cool, I stop talking. You can say that. You can say stop talking. I gotta do something. Like, one of my closing sentences might be some like, oh, okay, I'll be back later, so we'll keep talking about it. All right. Or sometimes my phone might start ringing. I'll be like, "Oh, I'm sorry, I gotta step out, but I'll be back." So yeah, you be a little smart about what it is you're trying to say or how you want to close the conversation, but just don't be mean. You know, don't be mean, because people are not gonna open up to you like this and just be okay with the fact that you close the conversation with, "Okay, bye," or just stop talking. I never heard stop talking, but I'm pretty sure in 2025 anything is a possibility by now. So I ain't gonna be surprised if somebody actually used stop talking to just close the conversation, because what the heck? But hey, it is what it is. Maybe, I don't know. I initially wanted to make this video to you up about like main characters, and I ended up thinking about different kind of nurses that I've met. And this is not even like the full list though. Like, this, whatever it is I just talked about, it's not extensive, so I can talk about more. But I ain't gonna be doing that because it's 5:47 a.m. now, and I'm gonna try. Well, I'm gonna go ready, get ready, and get out by 6. Be on campus by like 6:20, and review 2 more chapter summaries.
and go take the test because I'm taking the test at like 7:30 or maybe 7:45, and hopefully I'll only spend 15 or maybe 20 minutes on this. So yeah. So I'll say thanks for watching, and I'll put this video together though on my downtime because I do feel like I'm gonna have some downtime today. And I'm also have to do my nursing note too for my clinicals that I had yesterday. My ice is done, so I'm chilling. So I'll say thanks for watching. And I can't wait to actually record not next week videos, but the other video because I try to do like 2 videos every week. And I really like this format because I can actually sit down and think about something that I really want to talk about, and I do talk about it. But it's all mainly like I sit down to talk about something in one video, and then like the other one is usually like me doing fish stuff. So I don't really think that I'm gonna be doing fish stuff. So I think I might go to a store and actually like go see what's up, like what do they have on this specific store and stuff like that. So this might be fun though. This will be fun. And this is my little bicep from the gym. I gotta work out today though. So yeah, I'm gonna close this thing right now, and I'll put it together. So I'll say thanks for watching, and yeah, bye.